Well, welcome everyone, and thank you to those joining us live today and to those who will be listening into the recording later. I'd also like to warmly welcome our guest today, who I'll introduce shortly. My name is Ralph Altieri. I'm the Dean at the University of Colorado Skaggs School of Pharmacy and Pharmaceutical Sciences in the United States, and I currently serve as the Chair of FIP Education. FIP's vision is a world where everyone benefits from access to safe, effective, quality, and affordable medicines and health technologies. Our mission is to support global health by enabling the advancement of pharmaceutical practice, sciences, and education. And we're pleased to be delivering this event to you titled Transforming Our Workforce, Evolving the Pharmacist's Qualification. As you can see on your screen, can we go back one slide, please? We have some housekeeping announcements to begin. The webinar is being recorded and live streamed on Facebook. The recording will be freely available on our website, fip.org. If you have any questions, we ask you to use the question box provided at the bottom of your Zoom window. And lastly, we welcome your feedback on this event and of course others that you may be listening to in FIP's series at webinars@fip.org. If you are not a member of FIP, we encourage you to join us in the world of pharmacy practice, sciences, and education. At fip.org/membership, there is an underline after membership, followed by registration. So I've introduced myself. I'm the primary moderator today, and my co-moderator is Professor Ian Bates, who will introduce himself.
Thank you very much, Ralph. Good afternoon, good evening, good morning to everybody who's attending this seminar. I'll be supporting Ralph as we work our way through the seminar this afternoon. And if you have any questions for our panelists and our speakers, please use the Q&A function at the bottom of your screen, and I will try and extract those questions, and we can put them to the panelists as we work our way through to give you some voice and some input into this seminar. I'll just remind you, everybody, that tomorrow at the same time, the same time zone that you're in right now, we'll be having a follow-up webinar to this one, where we will be focusing on workforce and preparing the workforce. So I'd love to have your company with us at that event. Thank you, Ralph. I'll hand back to you now.
Thank you, Ian. So welcome to the Transforming Vaccination Regionally and Globally program by FIP. This is the first FIP transformation outcome-based online program of its kind that's underpinned and linked to the FIP development goals. The final outcome of this program is a historic global FIP commitment to action on vaccination and pharmacy. This program will go through December, and then that commitment to action will be published at that time. Thereafter, FIP will publish another report on the proceedings of this transformation program, the FIP Transforming Vaccination Collection, and we'll ask you to jot these down and keep an eye out for them on the FIP website so that you'll be able to download those reports. So the next slide. So this is the series that is going on in this entire transformation vaccination program. So there are 3 series. We are in series 1 right now. And series 1 events will focus on identifying the needs of the pharmacist and pharmaceutical scientist workforce to deliver on vaccination transformation. And so today we are in session number 6 of series 1, so it's 1.6. In each one of these, there are 8 different sessions for a total of 24 for the whole program. Series 2 events will discuss the actions required to deliver on the needs identified in our Series 1, aligned with the FIP development goals. And Series 3 will focus on FIP member organizations across the 6 WHO regions and how they have addressed or will address these actions to deliver on the commitment to transform vaccines globally and regionally. And we invite you to look for the dates of these different events in the different series and attend as many of these as you can. It's a very large program spanning all aspects of vaccination by pharmacists. So it should prove to be a really interesting and comprehensive program. So the webpage for this entire program is pretty easy, transformingvaccination.fip.org. And we urge you to engage with us as we go through this session today and help us answer 3 questions from your perspective. So in your opinion, what single factor should be prioritized to transform pharmacy vaccination services globally and regionally? What would be the most important achievement in terms of pharmacy vaccination services in your country in the next 5 years? And what else might FIP commitment to action outline or propose? As we're going through, you'll probably be thinking of responses to these questions. So I'll leave this on the screen here just for another few seconds, so you might be able to jot down some keywords here for yourself, so you remember what these questions are. Okay, I think we can move on to the next slide. So in today's episode, which is Workforce and Education Needs with a focus on undergraduate education, panelists with expertise in education and workforce development will discuss the integration of vaccination content into undergraduate courses so that every graduate pharmacist is able to vaccinate from their first day of practice. Discussions will focus on course development, accreditation, considerations for regulation around provision of vaccinations by graduating pharmacists, and the infrastructure needed within the existing workforce to deliver experiential contact for graduating pharmacists. Among many others, our main outcome for today is to define and quantify changes to existing undergraduate courses to ensure that newly graduating pharmacists are ready to deliver vaccinations. So that brings our introductory comments to an end, and we're now ready to begin to hear from our speakers. I'm pleased to introduce our first speaker, Dr. Lisa Nissen is professor and head of the School of Clinical Sciences at Queensland University of Technology in Australia. She is an experienced pharmacy practitioner, researcher, and educator, having worked in hospital and community pharmacy in both urban areas and rural areas of Australia. She is a leader of vaccination implementation in Australia through the Queensland Pharmacists Immunization Pilot Program. So welcome, Lisa. The floor is yours.
Thank you very much, and thank you very much for having me involved in such a great program for FIP. I think this is a great opportunity to talk about how we look at preparing pharmacists, and I think we've had a fairly short but rapid expansion of pharmacist vaccination in Australia, and as a course of that, having to look at how we prepare our workforce for the future, but also for the expansion of vaccination opportunities. So what I wanted to talk about really in this slide is how that sort of evolved for us. And I've got the tail wagging the dog as part of our first sort of metaphor, because part of the opportunity for us in vaccination came from a real push from our public health people and our profession at the same time, agitating for scope expansion around access to medicines and the opportunity to use pharmacists really as another health provider to give vaccination services in particularly the community space. And so in having that opportunity to expand scope through a real support from the government, we really had a fast uplift of service provision that we weren't really prepared for as a profession. So we had to upskill quickly where we were given an opportunity to offer these vaccination services. And we had to mobilize a number of stakeholders. So we had our pharmacy board, our registering body, our accreditation authority, and the profession all coming together to really uplift this pharmacy vaccinator. So next slide, please. And really to do that, we had to look at what the gaps were. And we really knew that pharmacists were already skilled in a lot of the relevant areas. Pharmacists manage cold chain. We understand what immunity is. We're really aware about what vaccines are. We know what the vaccination schedules are. We understand what anaphylaxis is and a lot of other things around what the competencies were for vaccination. And nationally in Australia, we had a framework for what immunisation education should look like for vaccination. And we also knew what the competencies were for pharmacists. And so identifying what the gaps were to talk to our stakeholders in government and to talk to our other health professionals about what we should be doing for pharmacy was kind of a fairly straightforward conversation, but we still had a number of people to convince, and some of those were our medical colleagues and some of them were our nursing colleagues who were already operating in that space. Next slide, please. And so what we were able to do was to work with a lot of our international colleagues that had already been operating in the vaccination space for a long time. And we had some good relationships with colleagues in Canada, and we thank them for their support, and particularly in Alberta, where their vaccination scope had been in place for a decade. And we were able to look at their opportunity around training for pharmacists in the community and uplift their training and adapt it to the Australian context, which gave us a head start. Show our government that that was a training that was specific to pharmacists and the gaps in competencies that pharmacists needed. And we were able to work with pharmacy practitioners and experienced nurse vaccinators in the context of the Australian space to modify that for Australia. And that really was very much like a CPD program at that point. It was topping up pharmacists who were already registered to go on and do vaccination. And it was pre-reading online. It was some MCQs to top up that knowledge about what is vaccination, what is the cold chain, what is our national immunisation program. And then really it was the practical skill-based development around giving vaccinations, the hand washing, those kind of technical skills that we don't tend to do in our pharmacy programs, or we do now, but we didn't at the time, that we really needed to uplift. And we did expert review of that before we implemented it. Next slide, please. So that's what our initial training looked like. And of course, we needed to do CPR and anaphylaxis as part of that training too, so that if we were dealing with an emergency or a declining patient, that was part of it. But it was really that in-class training that pharmacists really valued, because that wasn't sort of a normal everyday part of what we did in our practice. Next slide, please. So that was accepted by our government partners, so the Queensland government in this case for our pilot when we initially launched it, accepted that this was suitable training, that it mapped to that gap in competencies that they felt that pharmacists had, which was very much about administration of medicines. And that enabled us to go forward with our immunisation pilot. And we went on with the pilot in phase 1 and phase 2 to deliver over 30,000 vaccinations across the state using this training for pharmacists, and then roll it out through our professional organisations in an ongoing basis. But then the problem for us was that was a retrofit. So that was a retrofit of the profession, and we had across the country 32,000 pharmacists that we would have to retrofit. But what were we going to do for the future? So next slide, please. So CPD and retrofitting is one thing that we needed to look at, but in a parallel state, what we were doing is working with these stakeholders in our registering board across the profession and the accrediting body to look at how we could start to agitate to move this beyond a pilot into something that was a more substantial and ongoing opportunity for pharmacy and the profession in our education space. And so the board worked with the profession to look at acknowledging administration of medicines and management of adverse events as part of our core scope of practice and something that pharmacists did. And while it was probably something that was inferred in our competency, it wasn't explicitly in our competencies. And so that was something that was adjusted and made explicit. We worked with the profession around delivering an accredited training program. So the Pharmaceutical Society and the Pharmacy Guild delivered training for pharmacists that was accredited by the APC, which is the accreditation authority, and they delivered accreditation standards that allowed those programs to meet those national competencies. So that started to create that triangle or that nexus that we're used to with our accreditation process of competency, accredited programs and accreditation process that started to give us something that we can look towards for our undergrad programs as well. So next slide, please. So we needed to ride the wave. So if you look at this graph, what it shows you is a map of our profession in Australia. And what we've had is a growth of pharmacy graduates and pharmacy programs within the country over the last decade or decade and a half. And you can see that our lion's share of graduates or the profession really sits within that sort of 25 to 45-year-old age group. And so we've got this sort of thrust of people that have come through, and they're very much the group that have uplifted in that CPD space. But what we know is we've had an extension of scope beyond flu vax. We've had DTP, MMR, travel vaccines, ACWY added, and we know that through pandemic planning and with COVID arriving, that the government wants to use pharmacists as frontline providers for COVID vax. So what we need is to have more pharmacists that are providing vaccinations. And we want options to administer not only vaccinations, but other injectable medications. So to do that, we need to use our graduates that are coming out as well to be able to do these vaccination services. So retrofit's not going to get us there fast enough. We need to prospectively pump prime that system as well. And with about 900 graduates coming out per year, we need to be able to get graduates also doing that. So if we have the next slide as well. So what we've been able to do over the past couple of years is through various regulations in each state, enable interns who come out of pharmacy programs to do vaccination under the supervision of a pharmacist. So that means they can do those CPD programs and get their vaccination training. But now many of the state regulations have said, well, students can do it under the supervision of a pharmacist that has that scope. And it's also meant that the accreditation standards have now allowed students to be trained. So what is meant is that pharmacy programs have now included vaccination training as part of the training for graduates. And so many of the programs in Australia are still bachelor degrees that are 4-year degrees. There are a number of master's programs, but by far the graduating degree is still a bachelor's program. But my course that we offer includes vaccination as part of that training. So we're starting to now graduate people out with vaccination as something that they can do. So they can do it while they're a student, but also when they leave straight away, ready to be qualified. But if we're looking at what we've got to now, we probably have about a third of the workforce out of that 32,000 people that are ready to vaccinate. And if we're going to move forward, we really have to get graduates ready to go quickly. So just the next slide, which is the last one. So because we have students already and ready to train, we have all of these core skills that are already there. But I think it's also a great interprofessional learning opportunity, because what we've been able to do is work with our nursing colleagues, paramedical colleagues, and where it's available in other health programs, they would be able to work with nursing and with medicine and others to do interdisciplinary training around particularly the immunisation space and the clinical skills that are required. I did lie, one more slide. So just the final one. So in Australia, we are actually working towards, sorry, just if you can click over just to the last slide, moving the Australian qualification towards a Doctor of Pharmacy or a PharmD equivalent. And that will move us towards clinical and more diagnostic skills, more patient-centered care, more focus on pharmacotherapeutics and the medicines expert. And so all of the programs will be able to move vaccination and a number of other clinical skills, medicines administration and others into that space. So I think there's a lot more opportunities for us to include it consistently across our undergraduate courses, but many are already doing that now. And we've seen that evolution very quickly from 2014-15 to undergraduate accreditation being available for vaccination programs. And that's me done. Thank you.
Well, thank you, Lisa. That was a great way to start off our session today with the advances that you've made in this area, both for practitioners and for the undergraduate students. I'd have one quick question for you. Is that now an accreditation standard in your pharmacy education programs? So yes. It's a requirement.
It's, well, that's interesting. It is suggested that it's included. I think some of the limitation at this point, Ralph, is that the states in Australia haven't harmonised all of their drugs and poisons regulations yet, but the accreditation standard suggests that it's included.
So, as you know, in the United States, we have 50 states, so we have to coordinate all 50.
Yeah.
Good luck with that one. Yes. Okay. Do we have any other questions? I don't see any.
Hello, Ralph. Ian here.
Yep.
There's nothing on the Q&A. Some things may crop up during the rest of the webinar, which we can then bring back to Lisa. So maybe suggest for us to move on to our next speaker. I'll hand back over to you.
Sounds good. So our next speaker is João Guedes, who is a fifth-year student of pharmaceutical sciences at the Faculty of Pharmacy of the University of Porto in Portugal. I'll put in a plug for Porto. If you've never visited Porto, you should really do that. Put it on your bucket list. Wonderful place. From the 1st of October this year, he is now serving as president of the International Pharmaceutical Students Federation, which is an advocacy organization for 500,000 pharmacy students globally and recent graduates as well. It is always good to hear from the students and their perspective because they are our future. So I'll turn it over to João.
Thank you, Ralph. Good afternoon, morning, evening to everyone. It's always a pleasure to speak on behalf of IPSF. Thank you, FIP, for inviting us to talk about vaccination. So vaccination is a pretty important topic for IPSF in the past, but in the last years, we have been trying to improve the way that we are involving our member organizations in this discussion. So we wanted really for students all over the world to discuss about vaccination and also pharmacist-based vaccination. So for this, we created a procedure where we wanted to train our members to be involved in policy, to do policy research, and then build their national positions on vaccination. And this was quite important because this was one of the first times that our members were involved in policy and also doing research about their country and creating a position about how they envision the pharmacy pharmacist-based vaccination in their country. Then we created moments for them to discuss, regional sessions for them to create regional perspectives on the topic. And then in the end, we had our policy session where all 120 plus members from IPSF were able to provide their opinion about vaccination. We discussed what should be the opinion of the students in regards to education, practice, and science. And we drafted the declaration on vaccination. And for this, this was quite important because we knew that we were advocating for the opinions of pharmacy students in each of the countries where IPSF is present, and then not only the perspectives of the individuals that were part of the IPSF team. Please, the next slide. So what we also did is that IPSF is always trying to engage with our members and train them to be active locally. So we created last year an advocacy toolkit on different ways and frameworks for our member organizations, our national member organizations, to advocate for this topic, to raise awareness on vaccination, and also to advocate for development of the practice in their countries. We also were trying to train them on how to organize a campaign, and you can see different examples. So articles, for example, pharmacists as immunizers in Canada, awareness campaigns in Indonesia, and also online contact to raise awareness on this topic. And also how to be impactful, to really connect with the stakeholders that are involved in vaccination. So ministries of health, professional bodies in each country, and really try to start creating a framework for them to act locally towards this topic. Please, next topic, next slide. So what we also did was that we wanted to do more research and get to understand how is the current state of education in the different countries where IPSF is active. So we created an IPSF survey, which was called Preparedness of Pharmacy Students Towards Vaccination. And these are some of our preliminary results. So as you can see, most, a big percentage is having small amounts of vaccine-related education in their university curricula. Some have a multiple lecture or workshops, and some are having 17% are having a specific model for this. Also, regarding if they were confident in being able to vaccinate upon graduation, 37% said yes, 22 were not completely sure, and 41 said no. Next slide, please. We also wanted to know which specific contents are covered in their curricula. And as you can see, most of pharmacy education worldwide is still very much focused on theoretical, general aspects about immunization and vaccination, not really aspects that will empower students to then, as pharmacists, be vaccinating in their local backgrounds. So as you can see, 44% was covering, only 44% was covering administration of vaccines and injectable medicines, whereas almost 90% was covering general immunization concepts. It's also to be noted that allergic reaction and anaphylaxis and also national vaccination schedules were only covered by more than half of the curricula of the students that answered this. So regarding all this information, so the position from our members and the research that we also did as IPSF, we created a student's position on vaccination, and the student's position is calling on national governments and professional society frameworks for pharmacists to be authorized to administer immunization with proper training and certification, and also recommending that academic institutions include administration of vaccines in pharmacy curricula, and also emphasizing the potential of pharmacy-based immunization in increasing vaccination rates. Next slide, please. So also, I wanted to cover a bit more about my personal perspective and experience as a student. So as Ross said, I'm a fifth-year pharmacy student from Porto. So I was having in my curricula subjects like immunology, virology, and also first aid, which was a compulsory subject that I chose to have on my third year. First aid was covering administration of vaccines and injectable medicines. So I was having both theoretical components and practical lessons. So this is not mandatory for pharmacy students in Portugal. And when I'm asked if I think that I'm able to safely administer vaccines, so if I think my training and knowledge is sufficient for me to be comfortable to vaccinate, I would say no, both from a personal and legal point of view. So in Portugal, the law says that administration of vaccines, the ones that are not part of the national vaccination plan, can be performed in pharmacies by either pharmacists or nurses if they are legally authorized professionals to vaccinate. So in case of the pharmacists, they need adequate training approved by our professional body, which is Ordens Farmacêuticos, Portuguese Pharmaceutical Society, an FIP member. So this is our professional regulatory body in Portugal, and Ordens Farmacêuticos is responsible for authorizing professionals to vaccinate. Next slide, please. So what Ordens Farmacêuticos did was to create, first they created a pharmacist-focused competency recognition framework. So a document that was creating the rules for a pharmacist to be recognized to be legally able to vaccinate, and also specific pharmacist-focused guidelines on vaccination. So what we are currently having in Portugal is that this professional body is recognizing the pharmacists to be able to vaccinate, and those will have to have specific training that is not given in the university. It's something that is done post-graduation, and it shall include basic life support and administration of vaccines and injectable medicines. So different institutions can provide the training as long as they comply with the framework. After approval, pharmacists will be able to receive a certificate to be able to vaccinate, so recognizing this competency, and it extends until 5 years that can be then renewed with more training. Next slide, please. So this is the situation in Portugal. Before COVID, we were having 12 years of pharmacy-based vaccination, and currently we are having almost 25% of pharmacists in Portugal being able to vaccinate, which I calculated that is somehow 50%, so 50% of community pharmacists in Portugal. So the NHS and the pharmacy electronic records are linked, so the pharmacists can include information on the patient's electronic records about the vaccine that they perform, the vaccination that they perform, and also until this point, this intervention, this service by the pharmacists was mostly funded by the citizens, whereas it's free for elderly and risk groups in NHS. So what was started in Portugal was different pilot initiatives where different CTOs or different institutions were funding this service. So we started with the large municipality, and this CTO was funding this service. So in the first year of testing this new pilot initiative, 31.8% increase of vaccination rate in elderly in this municipality. So last year, we are a population of 10 million people. So last year, the flu season, more than 500,000 vaccines were being administered by community pharmacies. So this was before COVID. So this was mostly funded by citizens or municipalities that wanted to participate. Now, very recently, like in the past week, the government launched a different program, which is local NHS vaccination. So 150,000 free vaccines will be provided to elderly in community pharmacies in Portugal, and this will be funded by the Portuguese government. Additionally, pharmacies will provide 500,000 vaccines to the general population. So this is something that is constantly evolving. I wanted to share the latest news. Thank you.
Okay, well, thank you, João, for that overview of vaccination training and education in Portugal. At this time, I have to say, I've worked with IPSF over the years as part of my role in academic pharmacy section, and I just love the energy and the great enthusiasm by our students in IPSF organization, and staying on the forefront of issues related to pharmacy practice. So do we have any questions for Joao? It looks like there's.
Thank you, Ralph.
Mhm.
There is a question for Professor Lisa, actually, which is quite a specific one. So Lisa, if you could maybe have a look in the Q&A box for that,
Yep.
that's something for you. For
no problem.
George, I think I would like to ask the students, when you did your survey to the students, there seemed to be a lack of traction somewhere about what they knew, what they were aware of. Was that a surprise to you with the feedback from that survey?
We're currently analyzing all data, so all our conclusions we hope to probably share them at the FIP Congress in Sevilla. So we don't have many conclusions yet.
Okay.
So from the raw data that I was seeing is that there is a very different scenario considering each country. So there is a very heterogeneous response rate to the different countries. So as IPSF is covering now 97 countries, we're having very different responses and also very different feedback regarding either perception on the knowledge that they were having, because we are also testing that, and also the information that we were giving regarding the practice of pharmacists in their country.
Thank you very much. That's very helpful. We'll come back to Dr. Lisa now, if Professor Lisa Nissen, if we can, Ralph. Just a quick question, a very good one from Nagai, who's asking about how much resistance you faced from your regulators, from your legislatures in Australia. Was it difficult to overcome? Because I'm sure there was a little bit of resistance.
Yeah, no, thanks. It's a good question. I think because we had quite a lot of support from our Chief Health Officer to expand access to vaccination in the community. I think it was a really good story about advocacy, where you have the right people in the right place at the right time. But in Queensland, we were probably fortunate where other jurisdictions required a little bit more cajoling and probably a little bit more convincing by their regulators to change some of the laws to allow pharmacists to get that access. And I guess what we were able to do was leverage that support that we'd had from our Chief Health Officer to collect the evidence from the pilot in Queensland to then go on and use that in Western Australia and New South Wales, and then use that in Victoria and other states to then within very quickly a couple of years get the whole country on board. So we did get resistance in different states, and some were slower than others to come on board. What we did get interesting resistance from was, other than just our medical colleagues, which we kind of expected, you know, we say black, they say white, was actually from nurses. Which was unexpected because it was encroaching on a space that they'd often been doing community vaccination services and been running service vaccination in pharmacies for a number of years. So we found that was an unexpected barrier and resistance, and they were very vocal. And as you know, there's a lot of nurses and not as many pharmacists, and so they were very loud in their opposition. But it is a very great case where you find an advocate who is going to be your very good supporter, and we were very fortunate. And in this case, data was king, and we were able to leverage overseas evidence from, like yourself, Ian, in the UK, and colleagues in the US and Canada who've been doing it for longer than us. And our Chief Health Officer listened to that.
Thank you very much for that, Lisa. I'll just draw people's attentions to a very good and interesting comment from Jorge Robledo from Argentina. Worth reading. Thank you very much, George, for your comment. Ralph, I'll hand back to you. There are a few more questions, but we'll come back to them later when we have time. I think we should, over to you.
So we'll move on. Let's see, where are we? So our third speaker is Romeo Ongpoi, who is a assistant professor at Emilio Aguinaldo College in Cavite in the Philippines. He teaches pharmacy practice and pharmaceutical biology departments, and his research interests are in natural products utilizing endemic plants and in vaccination studies. And he's currently pursuing his PhD. So I don't know where he's got the time to speak to us because he sounds to be extremely busy. But welcome, Romeo.
Hi, thank you very much, Ralph. We can move on to the first slide, please. Okay, so thank you very much for having me here. And pharmacist has long been immunizers in other countries, like for example in the US. So training has been made way back in 1996, and before that, pharmacist has been immunizing in 1994. But it really started way long before, and there are a lot of success when it comes to pharmacists in vaccination. Now, if you can see in studies, pharmacist has been successful in preventing BPD or vaccine preventable deaths, and there are also increasing participation of the pharmacists, especially in the US, in immunizations. So aside from that, there is also success in increasing the national vaccination rate, like in influenza high-risk patients. So this has been going on in other countries for quite a long time. And also, a lot of people found satisfaction in the vaccination of pharmacists. And they have good overall satisfaction with the performance of pharmacists overall in vaccination. So let us refresh the role of pharmacists first in immunization, because the pharmacist does not only provide the injection to the patient. If you do so, that is what we call provider. And there are also other roles for pharmacist immunization, like for example, advocate, where the pharmacist can educate people to get vaccinated, and also he can be a partner in which he can host vaccinations in a particular location. So let's move on to the next slide first. Next slide, please. Okay, so how do we ensure that pharmacists are ready to give vaccinations? Now, based on the Philippine study that we did, we based the things that the pharmacist needs to learn, firstly on knowledge. So on knowledge, we identified a couple of things from our small group discussions. Principles of intramuscular administration is one. Handling parenteral products is also another. Identifying the need for immunization, and also identifying and handling adverse event during immunization. Now, among these factors, the most the part where the pharmacist in the Philippines needs a lot of help is the intramuscular administration itself, and also the adverse event during immunization. That is the part where they identified they need a lot of help. So as to behavior, we identified undergoing training for vaccination, now pay for training for vaccination, provide pharmacy vaccination services, learn and provide pharmaceuticals care specific for vaccination. Now, among these, it is actually the fee for the training, for the possible training that hinders the pharmacist from participating. But it is very much noteworthy to mention that from our study, the pharmacists in the Philippines are very much willing to support vaccination. And that is actually a good news. It's just that they need much help with regards to vaccination training. And this may be where the pharmacist, the pharmacy organization as well as the government can come in. So as to scale, you have the administration for IM injections, determination of the right vaccine, patient dose, and time. So we've determined that the determination of the right vaccine is actually the one that the pharmacist in the Philippines highlights. They need more help. So aside from identifying the basics of learning, we also focused in the environment, like the vaccination environment, because um, that is very important. Um, Although there are guidelines for pharmacies in the Philippines, but the counseling area that possibly where the vaccination may take place might not be there might not be enough space and other factors. So we've identified suitable environment, availability of qualified pharmacists in a facility for vaccination, availability of vaccines, availability of immunizing devices, storage or capability of facilities or drugstores. But among these, it is actually the suitable environment that the pharmacists are actually highlighting, because there are also cases in which some community pharmacies and some hospital pharmacies may not be suitable for vaccination administration. Like, for example, if the community pharmacy is involved with in an area that is really busy, and there are full of fast-moving goods in the pharmacy itself. And also there are areas here in the Philippines in which HIV has been growing. Actually, it's in the entire Philippines, but there are areas that are really highly concentrated with HIV, so that may actually be a factor as well. So next slide. Next slide, please. So on another study that we did a couple of years ago, so we actually based this on the American Pharmacists Association immunization guide. And we actually proposed an immunization training program in the paper. So it is important that we proposed a week-long training for the pharmacist immunization that includes, firstly, a pre-exam, of course, to have a baseline, and later on at the end of the training for a post-exam. Now, this is actually quite um, good, because it is also applicable to the current situation, because what we proposed was a synchronous and asynchronous activity. And this was before COVID. And right now, asynchronous forms of learning are very much common. So I guess we can actually pick up some ideas from this publication, actually. So for the day one, we actually ruled out that an introduction to pharmacist and immunization should be made, and immunization supplies as well as preparations. Vaccine storage and handling, because we mentioned before that those are part of the things that the pharmacist wants to learn, as well as the immunization protocols and documentation, because it's not only about giving immunizations, we also need to highlight some documentation, especially when you have some report on VAERS. And the day two can also be a home activity in which it can be done asynchronously. Like, for example, we can do some video demonstration as to administration for vaccines. We can use fruits for injection to practice. Yes, and also for the third day, we can do a small group discussion on local immunization processes and maybe immunization workflow models, because it's not the same. There are different models for that, and also marketing immunization services, because we know that pharmacy is also a business at the same time. So since immunization is done, especially for influenza, in an annual basis, so there must also be immunization reminder and recall systems to be discussed. The ADE, which was highlighted on the previous slide, and emergencies of immunization, like, for example, they might hit a nerve. So there should also be oral and demo examinations that should follow. And the fourth day, we propose an immunization case study, which can be done at home. And lastly, infection control is important, and objective structured clinical examination can also be done. So this is actually applicable also to the pharmacy students in the Philippines, because in the Philippines, the curriculum for pharmacy is currently transitioning right now. So this can easily be incorporated into the hospital pharmacy internship, but I don't think it can be incorporated to the lectures, because the lectures for pharmacy is very much loaded in the Philippines. So it can be done for the internship. And excuse me, also the vaccine product information and local immunization schedules, because it is actually different. Because it is actually different per vaccine, and of course the post-exam. Now, it is also important to um, note that in the Philippines, there has also already been a talk prior to COVID-19 with regards to pharmacists in immunization. And it was brought about by different stakeholders from the government, FDA, DOH, from the academe, and also from the professional organizations, the Philippine Pharmacist Associations. So in fact, there was already a training last year from the academic sector for immunization. Hopefully it will resume so that we can be prepared when the vaccine comes in for COVID. So, but there are also other countries in which there is still no vaccination ground that has been developed. So we propose that there must be a training needs assessment first that should be done. And it is also important that they do a hands-on training from a mature organization, like for example, the American Pharmacists Association. They have a program for that. And it is also important that a training program needs to be translated into the local context. That's why it's vital that there should be a local module for immunization, although the concept is the same, but the cultures are not. So module development per country is also, I think, is very important. Then when you are done with all this, then you can do with the training, you can actually prepare for the training deliverables, like for example, the venue and everything. And that is where you can then start your pharmacist immunization training, whether asynchronously or synchronously, or self-study and active learning. So what is also good is that for every training program, there must be an activity and evaluation, and as well as output that comes from it. Take, for example, publications, analysis of the metrics in order for it to be developed the most, and so that we can assess where the progress is currently at. So the process for improvement and dissemination should also be conducted because it is part of the PDCA cycle. So and if, for example, it is good, then maybe we can scale up in some locations. So that is actually how we envision the pharmacist vaccination training program when we did a publication last year. So next slide, please. So although we've discussed some of the considerations in vaccination, there are also noteworthy details that should be that adds up over time. Like for example, the epidemiology of the patient populations at risk for vaccine preventable diseases. So the population that are prone to getting certain diseases, like for example, COVID, they must be prioritized. And also the public health goals for immunization. We have different situations for COVID-19 right now. Some countries are very much affected. In the Philippines, we still have a growing case although the active cases actually fell down already. So we've talked about vaccine safety, screening for contraindications and precaution for vaccination in each patient. That's actually important. And also vaccine stability, because like for example, in the Philippines, we are a group of islands. So, and we have lots of mountains as well. So if you are going to transport these vaccines into the highlands, you need actually a good storage, because it might already deteriorate when it reaches the destination. And that happens actually in some of the studies I've read. So immunologic drug interactions also, we've talked about vaccine dosing, proper storage, preparation, and injection technique. We need to always remember that, because that is the part that has been said that they need more help. And also the signs and symptoms of adverse reactions for vaccines, ADR reporting and emergency procedures. Well, documentation is always there. Reporting to the primary care providing, also the billing part, because drugstores may also want to do some business for this in the long term. Okay. And we need to remember also the National Immunization Committee guidelines, because it is different per country, although supervised by the WHO. So for example, in the Philippines, the NIC in the Philippines, based on another study that we conducted last year, there is actually no pharmacist that sits in the National Immunization Committee in the Philippines. So that would be a disadvantage. That might be a disadvantage. So that would certainly that might affect the acceptability of vaccination when it kicks in. Okay. So the last slide, please. Okay, to summarize my points. In order to enable pharmacists to do vaccination, the most important thing would be the support from the government. Because as you know, in the Philippines, from the study that we conducted, it says that they are very much willing to do vaccinations, but the problem is they are not willing to pay for trainings. So I think that is where the government should address. If we want to do immunization for the people, we need to support pharmacists in terms of the training fees and the training as well. So another thing would be to involve core groups and collaborate. So one thing that I failed to mention is that we also need the help of the pharmacies, the drugstores associations also, aside from the fact that the government in the form of FDA Philippines or Food and Drug Administration's Department of Health, as well as the academe and the Philippine Pharmacists Associations are helping. I think that the Drugstores Association of the Philippines should also involve themselves, because community, as we know, is the first contact, is the most accessible location for people. And of course, that is where we plan to do the immunizations. So they must also be informed, because as of now, I don't see that. Okay, so I think that they should actually be involved in the planning. Okay, that's the only thing that I noticed that should be done. Okay, so and lastly, this is where FIP may actually be of great help, and that is what FIP is doing right now. So I think it is important to do certification and credentialing in, of course, a single global setting. It can be modified per country, but there must be a sort of a guidance from one authority that is actually a collection of knowledge from different countries. And I think that FIP can actually play a good role in formulating pharmacy certification and credentialing onwards, cascading it to the different countries that needs it. Okay, that actually wraps up my presentation. Thank you very much for listening.
So thank you, Romeo, for that comprehensive view of the status of pharmacist immunization in the Philippines. We are running a bit late We're at the end of our hour, but we have one more speaker, so we're going to just move on to our last speaker, who is Professor Jane Hanrahan, who is Professor of Pharmaceutical and Medicinal Chemistry at the University of Sydney, Australia. She has been involved in pharmacist vaccination training for the last 4 or 5 years, initially as a presenter and facilitator of the Pharmacy Guild of Australia's National Vaccination Course for Pharmacists. And in 2019, in collaboration with Professor Peter Carroll, she developed the Sydney Pharmacy School Administration of Vaccines by Pharmacists training program that is now an integral part of their students' final year of education. So I'll turn it over to you, Jane. Thank you for joining us.
Okay, thank you, and thank you to FIP for the invitation to speak. So this work has been carried out over the last 4 to 5 years by both Peter Carroll and myself. Peter has been very instrumental in pharmacist vaccination education in New South Wales. And you talked about having 50 states in America. Fortunately, Australia only has 6, plus 2 territories, but that means we've got 8 different sets of slightly different regulations regarding pharmacist vaccinations. So in 2014, the legislation was introduced in New South Wales that permitted pharmacists to administer influenza vaccinations. And the approved courses were essentially, according to the New South Wales standards, could only be run by the professional organisations. In 2015, those standards were updated a little bit, and it meant that our intern or provisionally registered pharmacists could also vaccinate under direct supervision. But when they must have had their provisional registration when they completed the vaccination training course. So that pretty much ruled out being able to offer that as part of a pharmacy degree at that time. We actually have 2 pharmacy degree programs at the University of Sydney, our standard undergraduate program, and we've also got a postgraduate program, which is smaller in size. And so for about 3 years, the day or a couple of days after our Masters of Pharmacy program, students had received their provisional registration, they came back in on a voluntary basis, and we'd put about 50 students through the Pharmacy Guild vaccination training program. But our students finish at the end of the year, so you're also sorry, up against Christmas. So we had a very limited amount of time to do that. Fortunately, in 2019, the standards changed again, increasing the range of vaccines that could be administered. But importantly, in terms of pharmacy education, any accredited pharmacy degree provider could now offer vaccination training. So that meant that we were able to offer vaccination training to both of our degree programs, so our master's program and our bachelor's program is much bigger. It generally has 200 plus students in the final year. And so we're able to introduce vaccination training to all of our students. Next slide, please. Okay, however, if we were going to use one of the established training programs that was going to be cost prohibitive for 250 plus students, so we decided to develop our own course, and so we went to the standard sources for the guidelines around that. So the accreditation programs to support pharmacist administration of vaccines, the immunisation framework that Lisa referred to earlier, competency standards for pharmacists. And also we've been collecting data for the previous 3 years when we had taught essentially pharmacy students. They'd only had provisional registration for 1 or 2 days. So we looked at the feedback that we received from them. And I don't think, it doesn't matter how much hands-on vaccination practice you give in a vaccination training course, I think people will always want more, but that was one of the pieces of feedback that came through strongly. They wanted to know about the specific flu vaccine brands, to do the course as close as possible to when they would start to vaccinate. And they were really positive about the real life vaccination experiences of the nurses and pharmacists that were also involved in teaching and assessing the course. And they also it's very good staff-student ratio. So there's generally Peter, myself, and at least one nurse and one pharmacist, sometimes two nurses, two pharmacists, to about 20 students. So it is very intensive, but the students really did like that. So having done that, we spent about 3 months developing our course. Next slide, please. Next slide, please. Thank you. So our course consists of 9 interactive online modules, so I won't go through them, but covering everything from immunity all the way through to the infectious diseases and their vaccines, the role of pharmacists as vaccinators, and the regulations and legislations that they have to comply with, all the way through to vaccine administration. Each of the modules assessed by MCQ questions. They can attempt the modules as many times as they like, but they have to get a final grade of 80% in each of the modules. In last year, we had a 2.5-hour sort of interactive seminar, lecture, revision, discussion of the modules, questions. This year, we've had to do it as lectures and put them online as recorded lectures. But then we also have a 5-hour skills-based workshop. So starts out with role play on informed consent, identifying patients that you should refer to other health professionals, through the vaccination area set up. We also go through anaphylaxis and vasovagal attacks. And then there's the final assessment where there's a real-life saline injection, both subcutaneous and intramuscular, into their partner. So the final assessment, although the course is now an compulsory part of the final year pharmacy degrees, the final assessment for it isn't compulsory. I think we had one student last year who chose not to do the assessment and not to get the certificate. And it's also not compulsory to have a saline injection if you really don't want to. Sometimes I think I've probably got more saline in me than blood, but we've managed to work around that. The anaphylaxis certificate is also part of one of our earlier units of study, so all our students have done that, but it's up to them to complete their first aid and CPR before they actually start vaccinating. Next slide, please. Okay, so in April last year, we started to deliver the training course. So we started out, we've run an intern training program, and so there was about 40 students who were interested in doing it as part of that, that hadn't had an opportunity to do it. We also included some of our pharmacy PhD, qualified PhD students, and some of the other staff in the school. We ran an additional program for some of our pharmacy preceptors who've been supervising our students on placements. And then in October and November last year, we trained 232 final year students. So we did pre and post surveys, and you can see the increase here in their perceived knowledge, skills, and confidence, and also their attitudes. And 94% agreed after the course that they agreed or strongly agreed that they were confident about providing immunisations to patients. So overall, it seems to be fairly successful. Final slide, please. And during the course of last year, when I was looking at things, and I came across the studies that have been done on the student-led clinics, mainly in the US and Canada, and I thought that just sounded like such a fantastic idea. And so we started to speak to people in the university about whether we could do a pilot program, interprofessional. So we ended up being able to take 8 students from medicine, nursing, and pharmacy. And although we started to ask or to discuss this in the university in about June last year, everybody thought it was a really, really great idea. It took us until early February to get final sign-off for it. and that was to run a clinic in mid-April was the original date. And so we started to set all this up, ordered the vaccines, started getting students, and then COVID hit. And so we're actually asked, it looked at one point as if we were going to go into full lockdown. The university shut down. However, in Australia, education was identified as being an essential activity. If you couldn't do it online, then you were permitted to do it in person. You can't do vaccine training or vaccinations online. So we took these students. They did a very similar course to what our pharmacy students do, slightly modified. And in early April, under direct supervision of vaccination qualified nurses and pharmacists, they administered about 300 vaccinations. And it was so successful that we're asked, could we get any more vaccines? Because at this point in time, there was a flu vaccine shortage because everybody had been encouraged to get the flu vaccine so as not to have COVID and the flu at the same time. So we're able to get hold of another 250 vaccinations, and we ran a second clinic in May. So you can see the comments here. All of the students really enjoyed the interprofessional aspect and being able to learn with students from other disciplines. And also really importantly, we surveyed the students who were vaccinated, and 92.4% of them said that they'd recommend the clinic to other students. So we're just starting to hopefully organise next year's clinic. Okay, and that's the end.
Well, Jane, thank you very much for going through that with us. Great progress in your programs. And I just want to give one real quick overview of vaccinations by pharmacists. And I put pharmacies in here also in the US, because I think, as we've seen from our 4 presenters, they're at different stages in developing their training programs or instituting those training programs and having pharmacists immunize. So, you know, some well established, some at the beginning. I was just going to do a real quick snapshot of what has happened in my country in the year 2000. Relatively small amount of education and training of students or practitioners to administer vaccinations. And in fact, I would say that in 2000, if I can remember all the way back then, I don't think I ever saw an advertisement by a pharmacy that they were providing vaccinations. If we fast forward to the year 2020, education and training of students and practitioners to administer vaccinations is now routine and actually a requirement in the education programs. In our school, and I know others do the same, but certainly in our school, we train our first year students to do this. And when they go out on placements beginning in the first year and beyond, and also in other types of non-curricular events, flu clinics and so forth, they are out there providing vaccinations. So by the time they graduate, they will have given hundreds and hundreds of vaccinations. And so they're well prepared and ready to go on their first day as an independent practitioner. What we see now is pharmacies are a primary site to obtain vaccinations, flu vaccines, routine vaccines, and travel vaccines for 18-year-olds and older individuals. I've been getting mine either by our students, flu vaccine every year, by our students, or by going to a pharmacy, and more often than not, it's one of our students that is giving me that vaccine. So last year, I did a flu vaccine and a shingles vaccine at the same pharmacy and administered by one of our students in training. And so we have, it's a very robust system within the education system, but also a lot of training went on of practitioners early on. And now we do very little of that because almost all of them are trained, and all the new students graduating for at least the last 10 years are all immunization ready. What is particularly new this year is our Health and Human Services Administration authorized pharmacists to order and administer vaccines to 3-year-olds and older individuals. So we dropped it from 18 to 3 years of age for administering these vaccines. And most recently, this past month, authorization to administer the COVID vaccine when it becomes available, also beginning at the age of 3 and then all the way up to senior citizens. And this last authorization included not only pharmacists, but pharmacy interns to administer the hoped-for COVID vaccine. And I suspect that we'll see pharmacy technicians added to that list probably in the near future. And of course, all of these require the adequate certificate training. And basically, as Romeo was talking about, the American Pharmacists Association has a long-standing training program, and that is the basis for the training that we use of our students. But I just want to commend everybody for the efforts that they're making, because this is a significant and much needed public health measure to get pharmacists and students trained in vaccinations to provide that service to our communities. So I think that while we all have more work to do, I think the future is bright in terms of the role that pharmacists will be playing in this public health sector of vaccination. And we've heard today, I think importantly, is all the different moving parts here. It's not just training the technical aspects of giving an injectable vaccine or drug. It's all the other things that go around it, the advocacy that's needed, the training, the environment, the regulations, the scope of practice, and on and on and on. And I think everybody did a great job of going through all of those different parts of what we need to recognize and make sure that our pharmacists are adequately trained in all of those areas, so they in turn can educate the public about vaccines, their importance, and the different types there are and what's best for them. So thank you very much to all of our speakers. Ian, I'm going to turn this over to you, because this is tomorrow's episode that will now, so today we talked about the primarily education in the student world, and this is going to be the rest of our workforce, and that'll be tomorrow's session. Ian.
Thank you, Ralph. So this is an advertisement for tomorrow. We have some super speakers with us and we will be looking more about workforce and how we can integrate ongoing competence and build in maybe a specific set of competencies for public health interventions such as vaccination. And I think some of the comments we've heard today from speakers about how we get that backfill going on with the bulk of the workforce will be brought up tomorrow. Thank you, Ralph. I'm looking forward to it. I'm looking forward to working with you and the rest of the team tomorrow as well.
Great. So lastly, again, I want to thank everybody. It was a great session. I want to thank all of the participants for sticking with us, even though we ran overtime. Really appreciate your attendance at this event. Again, this is recorded, and the recording will be available on the FIP website, fip.org. And your feedback on this program is welcomed at webinars@fip.org. And as Ian said, we hope to see all of you at tomorrow's episode 1.7. Same time, same station. So we'll see you then. Have a great day or evening wherever you are in the world. Thank you.
Goodbye, everybody.
Bye-bye.
Bye-bye.